Margot Sanger-Katz covers health care for the New York Times, and she joins us now. Margot, good morning. Thanks for being here.
Good morning. Thanks for having me.
Let's start with this whole idea of repeal only. Is that a viable option, and what would it do to the insurance markets?
It would be a very messy situation. The Congressional Budget Office actually looked at this scenario a couple of months ago, and basically what they found is that it would break the insurance market. So you would end up with a situation in which 18 million fewer Americans would have insurance next year. By the end of a decade, if no other changes would make 32 million more Americans would be without insurance, and premiums would double. So this is an idea that is premised on the further idea that they would be able to come up with some kind of solution, some kind of replacement bill separately. But it's an awfully risky strategy, because if all they can do is vote out this repeal bill, then there are a lot of very negative consequences that would flow from that.
So let's talk about the option that is presently on the table, the Senate bill. The president famously said that he thought the House bill was, quote, mean, and he wanted the Senate bill to have more, quote, heart. Does the Senate bill have more heart? It seems like the elderly and the lower income in America are sort of the ones that get the shortest end of the stick in this latest iteration of the bill.
Yeah, I think the Senate, they tried to go back to the drawing board and write a slightly different bill than the House bill. And I think they tried to address some of these problems that low income and older people were really disadvantaged under the House approach. But when the Congressional Budget Office did its assessment, they basically said, no, it's really not that much better. You're still going to have older people who really are not going to be able to afford their insurance, and lower income people who may be able to buy insurance, but it's going to be with such a high deductible that it's not going to be very useful to them. So, there was one big change that I think was important, which is the House bill took out pre-existing conditions protections in a really big way. This does it in a sort of more subtle way, which we could talk about. But I think if President Trump was worried about that, about pre-existing conditions, then maybe he is satisfied that this bill is a little bit less mean. But in terms of lots of people, and particularly vulnerable people who need health care losing their insurance, I think this bill has some of the same effects as the House version.
According to the Congressional Budget Office, the largest savings in this bill comes from reductions in Medicaid spending. What effectively would that mean for people?
I think it could have some pretty substantial effects. So the thing to understand is that there's kind of two parts of Medicaid. There was the Medicaid that existed before the Affordable Care Act, and then there was an expansion to Medicaid that happened as part of the bill. So part of the Affordable Care Act was that Medicaid went to a lot of low-income adults who didn't have children, who didn't have good health insurance options before. But the changes under this bill would affect the entire program. So that includes children, the elderly, disabled Americans, and some very poor parents of young children or pregnant women. And so, the assumption is that states will be able to make up the difference, or states would be able to find more efficient ways to provide care for those populations. But if you listen to the states, they say it's really not possible, that this really just amounts to a budget cut, which will result in cutbacks in care.
You mentioned pre-existing conditions. Let's talk about that. What is the measurable difference between the two bills, and what does it mean for Americans that have pre-existing conditions?
So what the Affordable Care Act said is that if you want to buy insurance, you get to buy it at the same price as anyone else, regardless of whether you have had an illness in your past. And the House bill said, no, insurers should be allowed to sell insurance to people who have a history of illness at a higher price than people who have been healthy. So that's not part of this bill. This bill does not. It still says, like Obamacare, that everyone has to be charged the same price. But it allows states to get rid of rules that set minimum benefit standards. So Obamacare says if you want to sell health insurance, it has to include prescription drug coverage, it has to include hospital care, it has to include maternity benefits. And this bill would allow states to say, no, 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 it doesn't have to cover those things. So you could imagine that someone, say, who has cancer might be able to buy a plan at a good price in a state that gets rid of these rules, but that plan might not actually cover all of the care that they need. So it's not as bad for people with pre-existing conditions, but it could be worse for people who are sick.
Okay, an important difference there.
Yeah, and we still have no final legislation, the other important note. Margot Sanger-Katz, thank you so much for being with us this morning.
Thanks a lot.